let's start by looking at rhinitis, which is an upper respiratory tract infection, which is inflammation or irritation of the nasal mucosa or the mucous membrane of the nose, and it manifests with nasal symptoms, more especially those like congestion, runny nose, sneezing, and itching. So rhinitis can be either it's acute or chronic, it's allergic or non-allergic. Acute conditions start suddenly, and those are chronic. Those that are chronic get to last for a long period of time. Acute lasts for a shorter duration. Chronic lasts for a longer duration. So acute, with the treatment, they get to resolve quickly and you get to restore normal function. The chronic, sometimes you just manage to maintain the quality of life of your patient. Then the allergic versus non-allergic, I believe we know that. Those that are predisposed to allergic reactions and those that are not of non-allergic origin. So mostly the allergic, if one is exposed to airborne particles like dust, the cat dander, dog dander, cockroach droppings, plant protein, pollen, anything that it can really trigger an allergic reaction. Then an allergic rhinitis, which is also referred to as the viral rhinitis or the common cold, caused by viruses like the influenza virus, the rhinovirus, and the coronavirus. Basically characterized by nasal congestion, rhinorrhea, that is a runny nose, sneezing, sore throat, and general malaise. So usually most of these common colds or rhinitis is associated with the immune response, and the causative agent, be it a viral organism or bacterial organism, it does not have any structural damage or nasal epithelial damage. It's just one being exposed to the causative agent and manifesting with the symptoms. And the symptoms are most times cough, in majority of the cases, runny nose, a congested nose, rhinorrhea, sore throat, and then muscle pain, which is least common. So mostly to diagnose rhinitis, physical examination and history taking should be able to basically diagnose for you rhinitis. But if you want to go further, you can do a blood test. You check for the IgA antibodies to determine if allergies are the cause, more especially if you are dealing with a situation where allergies are suspected to be the cause. To manage rhinitis, you still go back to what is the causative agent. So you manage the cause of that infection. If it's allergen, I advise the patient to avoid those allergens, exposure to those allergens. If it's viral, then you can prescribe antiviral medication, which is just going to relieve the symptoms. If it's of inflammatory nature, corticosteroids can be given just to reduce that inflammatory reaction. If it's bacterial cause, antihistamines, corticosteroids again, which can be given as nasal sprays, can be given just to relieve the symptoms. Otherwise, rhinitis is one condition that can easily relieve itself without having the patient having to take up medications.